Today, we're learning the different classifications and types of shock. Remember, shock is not simply low blood pressure. Shock occurs when the body's tissues and organs are not receiving enough oxygen-rich blood. To make shock easy, remember three words: volume, pump, pipes. The problem is either not enough circulating volume, a failing heart pump, or blood vessels that are too wide. Let's begin with hypovolemic shock. Hypovolemic shock means the tank is empty. The body has lost blood or fluid. Common causes include hemorrhage, severe dehydration, vomiting, diarrhea, burns, and internal bleeding. As circulating volume decreases, the heart beats faster to compensate. Blood pressure falls, the skin becomes cool and clammy, pulses become weak, and urine output decreases. Remember, hypovolemic shock equals an empty tank. The priority is to stop the fluid loss. Replace volume with intravenous fluids or blood products, provide oxygen, and monitor tissue perfusion. Next is cardiogenic shock. Cardiogenic shock means the pump is failing. The body may have enough blood, but the heart cannot pump it effectively. Common causes include a large myocardial infarction, severe heart failure, cardiomyopathy, valve dysfunction, and dangerous dysrhythmias. When the heart cannot pump forward, blood backs up into the lungs. The patient may develop shortness of breath, crackles, pulmonary edema, jugular venous distension, chest pain, cool skin, weak pulses, hypotension, and decreased urine output. Remember, cardiogenic shock equals a broken pump. Treatment focuses on improving heart function, treating the underlying cardiac problem, providing oxygen, and administering medications such as inotropes when prescribed. Fluids must be given cautiously because excessive fluid can worsen pulmonary edema. The third major classification is distributive shock. Distributive shock occurs when the blood vessels become too wide or dilate excessively. The heart may still be pumping and the blood may still be present, but the vessels are so dilated that blood pressure falls and blood is not distributed effectively. The three main types of distributive shock are septic, anaphylactic, and neurogenic shock. Let's start with septic shock. Septic shock begins with a severe infection. The immune system releases inflammatory chemicals that cause widespread vasodilation and increased capillary permeability. The vessels become wide and leaky. Fluid moves out of the bloodstream and into the tissues. Early septic shock often causes warm, flushed skin, fever, bounding pulses, tachycardia, and hypotension. As the condition worsens, the patient may become cool, confused, hypotensive, and develop organ failure. Remember, septic shock is warm early and cold later. Treatment includes rapid intravenous fluids, blood cultures, prompt broad-spectrum antibiotics, source control, and vasopressors when hypotension continues despite fluids. Next is anaphylactic shock. See you in the lecture.